1 in every 3 Americans will be diagnosed with cancer, but there is now a new local center providing hope, Mission Hope Cancer Center, located on the Marion Regional Medical Center campus. Mission Hope is an integrated oncology facility, providing the latest in advanced technology with the highest level of patient comfort, convenience, safety, and service. As a UCLA affiliate, Mission Hope features expert physicians, healthcare professionals, and treatment options only offered at major teaching centers.
Hello, doctor.
All right, pleasure having you.
Thank you. Thank you for the tour.
No problem.
Good. Are we ready?
We're ready, and let's
do it.
take a look inside. So we're starting here on the outside of the Cancer Center. So this is our 44,000 square feet building, and this will be the entrance that most people use coming in, and we'll circle around to this area here.
And as I understand it, you've already started treating patients here in Santa Maria.
We've started treating the medical oncology patients, which are the patients that are getting chemotherapy, and the radiation therapy should start within the next month, and CAT scans, mammograms, all that stuff should be coming on board within the next month as well.
Wow.
So this is the lobby here where most people will come in initially to start. We have volunteers that work here every day from Marion Hospital. And this is where people will go to the rest of the building, and we can start here at radiation.
How did you come up with the
oncology.
name Mission Hope? I'm just curious about that.
We thought a long time about what to name the place, whether it was just a regional cancer center or just the cancer center, and we thought about it in two perspectives. There are a lot of missions up and down the coast, obviously part of our heritage here in California. We don't actually have a mission here in Santa Maria, and our mission was to provide this kind of care for the patients.
And hope for the patient as well.
Hope for the patient. So when we put all those concepts together, that's what we came up with, Mission Hope Cancer Center, and the symbol just kind of symbolizes the ocean, the greenery, and the blue skies that we always have here in California. So that's how it all came to be.
That's great. Really great.
So through this way is the Radiation Oncology Department, which has not started seeing patients yet, but hopefully our facility will be ready to go and see patients in about a month's time. We'll go in and see the linear accelerators, which are now being installed. And this is where people will wait for their appointments to see the physicians. Through that wall, that's actually a temporary wall which we can open up and make this a larger facility. Our conference room is located behind that wall, so that in the evenings we can have support groups open up that wall. It's attached to a kitchen. We can have talks and support groups and other physicians come in to talk to the community through there. So
Truly amazing.
So
it really is.
we'll see how
And
functional
your
it is here.
mural on the glass is unbelievable.
A friend of mine, Chris Burkhart, a friend of mine from church, is a surfing photographer, and he had a lot of these pictures on his website and at his access, and so this is a new process. I don't know anything about photography, but they tell us it's a new process where the picture is actually etched on the glass.
I've never seen it before, and it's really, you know, when you look at it, you can't believe that it's there.
And it gives you a different feeling.
Yes, it does.
In the room, but allows a lot of light to come through. So, all right.
How many square feet is this building?
So 44,000 square feet
44,000?
total, about 11,000 or 15,000 each floor. We'll go on through here.
Everything is very serene. And the colors are all calming. And
We tried to create that atmosphere where
really
the patients
is.
are not feeling like they're coming into a hospital, a clinic, that kind of thing, where it's a little bit more, not quite a spa feeling because it's not a spa, but Dr. Ketting will mention a little bit later that radiation oncology patients are a little different. They come in for sometimes as little as 15 minutes.
no kidding.
So what we did out here was created what we call our secret garden. So we can still see the picture of the lobby.
That's amazing, though. It's on both sides.
It's on both sides. So
that
what we
is
can do
amazing.
here is a spouse that's maybe bringing their wife or their husband to radiation oncology for that 15 minutes can sit out here, read a newspaper, have their coffee, and the patients themselves don't have to necessarily go through the lobby. They can actually come right through the secret garden here and directly into the check-in area for radiation, so they can really make their daily experience a quick 15 minutes, and it doesn't disrupt their day as much. So they're in and out quickly, and obviously
so
the plants will
beautiful.
grow in a period of time, and it will be comfortable to sit here. And this part of the building's shaded from our Santa Maria winds that happen 2 or 3 days a year. So
Yeah, I noticed you have it on the side where no wind's coming
yeah, so
toward
they'll
you.
be protected here. But
That's great.
so some of the patients will actually come right through here and then right into the check-in area for radiation oncology, because you can imagine if they're coming to treatment every day for just 15 minutes, but 35 days in a row.
Is that what it takes? 35
For a
days
lot of
in a
the
row?
treatments, it's 35 days or so in a row. So
Depending on what your condition is.
depending on
I'm
what
assuming.
your diagnosis is. So that's a lot of days to be coming in, and so as quick as we can make that, that's the preference. So this will be the check-in area, which is obviously not functional just yet. This will be the area where patients get their actual radiation treatment on a daily basis. They'll go into the changing rooms and then come out into this area. This is Dr. Ketting,
Dr.
who
Ketting,
is
nice to meet you.
our main radiation oncologist in town here, so he can explain us a little bit better about
great.
how this area works.
This isn't all our department, but it's really the center of operations, as you can imagine, every day, 35 days in a row for a patient. And it's a very high-tech area, but we try to keep it high-touch as well, which is, of course, the goal of the whole cancer center. This is just our control area, and as you can see, we have 6 monitors, because there's just tons of computing horsepower there. This could probably send the shuttle into space and back a few times. But this is
The
just
poor
the
guys
control.
on Apollo didn't have that good of a computer.
They did not. No, Apollo 13, they had to think on their feet. And then the treatment machine here is a linear accelerator. It's technology that was developed in
Oh my gosh. Oh my God.
the
Is this impressive?
1950s and has been continuously updated to be a completely computer-controlled machine that can account for all sorts of motion. And in some ways, we think of this machine as something that can kind of chase you across the room if you move and stay.
It looks like it could.
Yeah.
It is absolutely unbelievable.
And just to clarify, what you have is radiation very precisely metered and controlled coming out of here.
Is it pinpoint? I mean, can you take it down to a pinpoint? Is
If
that
you
it?
need pinpoint, we can do it. If you need a wider field of radiation, we can do that. This will do just about everything that's out there.
In other words, it does the least damage to the good cells that it possibly can.
It's all about targeting the disease and avoiding damage to any of the normal structures. Part of that process is this part here, and this is a modified CT scanner. So when we put the patient on the table, we'll do one rotation of the machine around them and actually get a three-dimensional view of their anatomy. And if they are 2 millimeters off from where they need to be, the machine will move and get them perfectly on target.
My God.
And that's a semi-automated, actually
Oh my
kind of an
gosh.
automated process.
Now, when did this kind of a process even begin? This has got to be pretty new technology.
This machine just came out from Varian, which is the U.S.'s prime producer of radiation equipment. It's their newest model. It's a complete clean sheet design, complete rewrite. And I think this is serial number 156 or so. So it's very, very
Very new.
early, but it's old enough that it'll treat you right. It's not
Oh,
a bleeding end production prototype.
I understand.
Yeah. Let's see, and I was trained as an engineer, so I like to do this part.
This is your favorite part?
This is the fun part, yeah. This is some of the
Oh
guns.
my gosh.
So I'm not sure I can tell you everything that does, but let me put it this way. We have a doctorate in physics that keeps this machine doing what it's supposed to do.
No fooling.
Yep. The guy has a whole PhD in physics, and his job is the
That's his job.
care and feeding of this machine.
Oh my gosh.
Yep. So.
And I noticed that on the ceiling, you also have the serene, once again, the ocean and the, looks like Hawaii almost. And that's
Yeah.
what the patient is looking up at, obviously.
Yeah, we, this was actually a revolution in the 20 years I've been doing this field of all of a sudden realizing that, putting somebody on the table in a white room, staring at the ceiling, it's a scary experience, especially with huge equipment like this, rotating around and doing it stuff. So we pipe in music now, and we have views like this for them to sort of kind of meditate. Hopefully
And
they
how
have
long are they
thoughts.
on the table, doctor?
Well, that's another revolution with this machine. It used to be 10, 15 minutes for the machine to do all its articulations. We expect treatment times of 3 or 4 minutes because this
You're
thing
kidding
is
me.
so computer controlled,
Oh my
it'll just
gosh.
buzz right around and do the treatment.
Oh my gosh.
So it's quicker for the patient, which means we're more accurate, and of course it's less taxing for the patient to
Yeah.
just buzz it and get their treatment, go
Oh
home.
my gosh, it's hard to believe. This is amazing, totally amazing. Oh my gosh.
So nobody ever wants to have to use it, of course. But
No, but hey,
we're
if
here
it's
to use
there,
it.
that's what it's there for.
Yeah.
We want to be sure and use it if we have to. 3 to 4 minutes for a treatment.
Yeah.
Unbelievable.
It'll probably take about 2 minutes to do the initial imaging, get precisely on target, and then another 3 to 5 minutes to do the treatment. So all told, probably door to door, it may be down to 10 to 12 minutes.
My gosh, like a cup of coffee.
Yeah, and hopefully it's that pleasant.
Let's hope so. And I notice because of the radiation, I see you have huge doors, lead, I'm assuming, to shield.
Yeah, the doors are typically lead, and as you can see, these sort of radiation beams, it takes that much lead to stop it.
No
So
problem.
patients often ask me, well, aren't you going to put one of those little lead aprons on?
That ain't gonna do it.
I tell them, wouldn't stop a thing, not with this stuff.
Now, where is the operator going to be at if you have that much radiation? How is the operator secured?
Well, the radiation is only on when the machine's on, and the operator's outside. That's part of the reason we have so many monitors. We have a full video and audio link here, so we're able to talk to the patient, tell them, and so anytime the beam's on, the operator's out in the front.
And the patient is the only person in the room when the beam is on.
Absolutely.
Got it. Gosh, that's amazing. Wow. That is something. Entrez-vous, s'il vous plaît.
We have another machine over here that we brought over from our other facility. So these machines will not match in capability, are matched in their energy. So if we should have a problem on one machine, patients can still be treated over on this machine and not miss any treatments. We find that to be very helpful.
And this is an older machine?
A little older machine, yeah, but it's from the same manufacturer, and we're able to match exactly. So you can basically take one computer treatment plan from this machine, move it over to the other one, and just treat.
And where is this machine built? I mean, is this a American machine, or is it European, or?
Follow the 101 right up to Palo Alto.
Oh my gosh.
Varian Medical Systems.
You're kidding me.
American made all
Right
the
here
way.
in California.
And guess what? We're selling them to China.
That's amazing. Let's do it. We'll take their money anytime we can.
Absolutely, yeah.
Bring it to us. Thanks again, doctor.
All right, thanks, guys.
Okay.
All right, well,
Okay.
that's the latest in that technology.
Well, you know what's so amazing is the technology is here available in Santa Maria. And it's so on point and it's so advanced. It's hard to believe. People are not going to be going to Stanford or other areas when this kind of treatment is available.
And I think that's one of the benefits of starting something new like this is you can take advantage of putting new technology in when you're starting from square one rather than having to change things out.
Right.
And I think the advantage of having Dr. Ketting's group, Coastal Radiation Oncology, in our group is it allows us to take advantage of their strength in the market and allowing us to upgrade that technology when on our own we probably couldn't do that. But well, speaking of technology,
amazing.
let's go down the
Let's
hall and
do
we'll
it.
look at our next technology. So as far as
It's
the
going to be
radiation,
hard to surprise me anymore after being the surprises of you.
that's good to know. So patients that come from the hospital will actually come through this back door here, and they'll be
Oh, they
housed-
come in through the back.
So every so often we'll have a radiation oncology patient that's in hospital and needs to come here on a gurney. So they'll come here on a gurney, they'll stay right here for a few minutes and then go back by ambulance. So we have a special door with a camera on the outside so that they know who's there and how to get in.
I'll be darned.
And so these are just doctor's office, but if we go through this door, this is the imaging department for the building. So Marion operates and runs this part of the department. This is where we house our CAT scanner and our PET scanner. So again, we've tried to upgrade the technology as best we can. Currently in Santa Maria, we only have a PET scanner that comes in. It's a mobile device that comes in twice a week, sometimes only once a week. Obviously, the quality that we can now deliver with a machine that's here permanently is going to be much superior. So people will actually come in from their own entrance here, which will be marked as the imaging department, so they don't have to funnel their whole way through the building. We have a separate waiting area for them here, and then they'll come right in here to the CAT scanner. And
Well, it's really obvious that you really thought this all out.
we try to think about it from the patient perspective, and we actually have had a lot of input from patients so that we could get a feel from them what makes this whole process difficult and what makes it a lot easier. So I'm going to introduce you to Dr. Sonnabend, who's one of our
Doctor, nice to meet you.
radiologists here in town.
Nice to meet
and
you.
he can fill you in a little bit about the equipment we have here.
Yeah, welcome. Well, what we have here, we have twin suites, and in this suite over here, we have a PET CT scanner, which is a way of imaging patients with cancer to look at the metabolic activity of their cancer and to see how it's responding to treatment. And this fuses positron emission tomography and CT scanning.
Easy for you to say.
Absolutely.
Tough for me to say.
I've practiced a lot. And this unit over here in the other room is a straight CT scanner for routine imaging of patients. That does not have the nuclear medicine capability of fusing with the PET images. But both of these are state-of-the-art scanners. It's fantastic to have them under one roof here, integrated with our cancer program. And no longer will we have patients going onto a trailer, a portable
Right.
system, which is what they've been doing up till now for the PET CT.
And this is the one that goes bump, 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 bump.
No, that's
Nope.
the MRI.
Oh, is that the MRI?
This is-
okay, that's the one I had, was an MRI.
This is quick, this is quiet, it's a lot easier to go through than an MRI, and we've tried to make this very aesthetically pleasing for our patients. We have the light panels on the ceiling so they can kind of get a sense of being outdoors,
Oh,
something
yeah.
very pleasant to look at.
Oh my gosh.
Now, there's a lot of anxiety when patients come in for these images, and we want to make it as pleasing and as relaxing for them as possible.
And how long is a patient on going through this?
The actual scan time on the table is short. There's a little bit of preparation before they go into the scanner. They're injected with a radioactive material. They need to sit quiet for a little while in a different room to allow that to circulate in their body. And then they go on the scanner. The scan time itself is only a few minutes.
Is that right? Oh my gosh. It's just amazing that this kind of technology is available here in Santa Maria.
Well,
It's unbelievable.
It's something that we've been waiting for, and it's something that's finally arrived, and it's been a vision of Dr. Dickman's. It's finally come to fruition, and with the help of our community and our hospital, I mean, here we are. And I think the days of people leaving town to go for care at the big universities,
They're over.
It's over, absolutely.
They're over.
Absolutely.
Yeah. Well, it really makes you proud to be living in Santa Maria, to have people like yourself and Dr. Dickman and Dr. Ketting, to be able to give this to the people of Santa Maria. This is literally a gift to the city of Santa Maria.
Well, I've been serving here at Marion Regional Medical Center for 16 years, a proud 16 years, and for all this to be going on right now, I am so excited.
You are.
So proud to be part
I
of
could
it.
tell.
Yeah.
I could tell you are. Yeah, it's amazing. Truly is.
Well, we can actually continue the rest of the tour and catch up with Dr. Sonnabend one floor up, where we can look at some of the breast imaging department that's
Great.
going to be relocated into our facility if we want to come out through
See
this
you
way.
upstairs.
I'll
Okay.
be there.
So we'll take a quick look into this area. This is not an area that patients usually would travel to very much. This is all related to the actual CAT scanning department. But we'll take you through right down to the end here. This whole section of the building is more or less our cancer support area. So we have located all of Marion's cancer support area into this one building. So people can come in through, again, a side office, meet a receptionist here, and part of cancer care is in having multiple disciplines involved. And so all of our patients, we would like to have a dietitian, a social worker, nutritionist, all of that involved. And so we've
Full
created
gamut of treating
because
the
eventually
patient.
they all need it, or they certainly need education to go along with whatever treatment they're getting, and that's helpful. So down in this area is where we're going to have these things. We have nurse navigators, which help them through the whole process of their whole cancer care.
In other words, a nurse is assigned to the patient that navigates them through the
Through
entire
the entire process, exactly.
How great.
We have one that works very efficiently. Liz Elliott right now through breast cancer. Sean Hunt is one of our nurse navigators that is helping some of our patients go through in other cancers, and we're going to just keep developing that as it goes. But it's made a huge difference. A place and a person that you can ask a specific question to at any time during your treatment, and if they don't know the answer, they'll find a way to get the answer. So some of the support services are located here, where we have our Look Good, Feel Good room here, which is really where
This
patients
is
come in and have their wigs fitted or makeup, and they have training sessions where how
How
to
to
deal
do
with
it.
baldness and some of the issues that they have. So we have that right on facility now. Again, not
In other words, compassion is a big word in your business, that's for sure.
Well, it's an important part of we might be treating them once every 2 or 3 weeks, but they have to live with the effects of the treatment. And for women, obviously, hair loss is a big thing. And
Well, it's a big one for men, too.
It is. And so this is a way for us to be able to, once again, make it so they're not constantly going out and having these services done somewhere else, but they can do it right here. So we'll also have some massage therapy here. You can see in that room. We're going to hopefully have acupuncture. So we're trying to include all elements of care of the whole body. And again, in this one facility. Some of these programs are going to take some time for us to get fully developed, but certainly are a work in progress.
You're
that
working
we're
toward it.
working towards, exactly. So
All
this
right.
portion of the building is not so much patient related, but more for us, the physicians. So every week on Tuesday, a group of us, Dr. Ketting, who you met, Dr. Sonnabend, we meet and discuss essentially every brand new diagnosis every week. So we have about an hour and a half working lunch on Tuesdays, go through each one of their cases from their pathology to their films to how they presented, and we get to look at the films, we get to look at the pathology under the microscope on these screens, and then we can make a recommendation on how to move forward. Now the patients, sometimes we haven't even met them yet, or we're about to meet them, or maybe we've just met them for the first time. But it's very reassuring for them to know that we're going through their whole case and figuring out what the
Ahead of
best
time.
approach is.
Yeah.
So this is where we'll do all that. We'll have all the technology set up so that everything's easy and available for us on the screen, so that we're
That's
not
great.
looking through microscopes anymore, but everything is digitally done.
And that's
Through
right.
that wall takes us back into the main lobby, which we discussed last
Oh,
time.
yeah,
is
that's where you can open it up.
Right. So on the
Yeah.
other side of this wall is a little kitchen area, so that's where we can have our nighttime conferences.
Unbelievable.
And then what we can do is go up these stairs here
All
and
right.
it'll take us to the second floor. Okay, well, we've arrived on our second floor, and this is actually a general waiting area for patients that will wait to see surgeons and breast imaging and whatnot that we'll see on the rest of this floor. It gives us a good opportunity to see just how close we are
my
to
gosh.
the new Marion Regional Medical Center. And that was one of our important parts of the puzzle as well, is that we, as physicians, are going back and forth to the hospital on a daily basis, sometimes 2 and 3 times a day. And this allows us to be able to not have to get into our car every time, be very close by. And if there are some procedures that the patients need to have in the hospital, they're very close for us to make arrangements for that to happen. So we feel lucky that not only do we have a new cancer center, but we have a new facility opening up in the next month as
Right.
well. So
And
really,
you have a great relationship between the two as well.
we have a great relationship between, this is really a combined project between the hospital and ourselves, and it's going to make a big difference again to the patients, because we're now delivering quality care not only as outpatients here, but as inpatients in the hospital. So
Tremendous.
so if we head down this way,
All right.
the breast imaging department is an excellent department already in the hospital, and we did not want to recreate that, but rather just move it. So in this area, we'll run back into Dr. Sonnabend, who will take us through.
again.
How are you
Nice to see you again.
So he'll take us through a little tour of the breast imaging center.
Sure, this is Marion's Breast Imaging Center, which this is the new home. We have been here on the campus of Dignity Health for many, many years, but these are the new digs. We haven't completely moved in. We'll be moving in probably in May once we get everything inspected and online. So we've got a really beautiful facility here. Most of the rooms do not have any equipment in them, but we do have one beautiful new piece of equipment that I'm proud of and I want to show you. And this is our hologic breast biopsy table for stereotactic breast biopsies. And this is replacing an old unit that we have in our other office. And it's brand new, state-of-the-art, and this will allow a lot more to be done here at this facility. There are women that we have sent to other facilities in the past because our equipment just wasn't able to accommodate them. And this table is really going to broaden what we can do here as far as biopsies.
Truly amazing.
And all of our rooms here will be state-of-the-art digital imaging for mammography, and we'll have ultrasound here as well. And it's wonderful to be here under one roof where we can communicate very easily with the breast surgeon, with the radiation oncologist, with the oncologist, all of the ancillary support team, the social workers and such, to be here under one roof and to be able to coordinate everything is going to be so much more convenient
much
for
more
patients and their family.
Yeah.
Very
Well, and then they don't have to go out of town to do this kind of.
No more.
No.
Yeah.
Great. Unbelievable.
Pleasure to share this with you.
Well, thank you, Doctor. I'm glad to see this.
Imaging is a huge part of what we do as radiation oncologists and medical oncologists, and so Dr. Sonnenbein and I will be talking on an almost daily basis regarding our patients and some of the thought process that we put through the building. For example, this last room here is not got anything to show in it right now, as we haven't officially moved in, but this will be where Dr. Sonnenbein and his colleagues read all the films. And we've strategically put this exactly one staircase away from our patient area upstairs and the patient area downstairs in the radiation oncology department, so that once Dr. Sonnenbein and his group have moved in, we're just one quick flight away to be able to come down here, share our ideas on the films together. There's nothing that's better than looking at those pictures side by side with the radiologist and making a plan. So those are the kind of things we thought about to make our lives a little easier taking care of the patients, but also the quality of care for the patients. If you suddenly have to go across town to look at an x-ray or across the street to look at an x-ray, the tendency is to not do that.
And that's what it used to be.
It used to be.
And the patient had to go from place to place to place. And now you're in one building doing it all the time.
Right. And in our business, we can't rely on just reading a report. We have to go through things in detail to make sure that we're on the right track. So
A picture's worth 1,000 words.
right.
Yeah, I think I've heard that. Good, Doctor.
All right, we're going to move this way through to our research department.
Good. Oh my
Thanks,
gosh.
Thanks, Dr. Sonnenbein.
Thank you,
We'll catch up
Doctor.
with you later.
We good now. Thank you so much.
We'll see you later.
So this, again, is another area that patients will not be involved in coming into very much, but
This will be for the doctors and their
well,
staff.
we're going to have a psychologist hopefully located in this area, but the department that we have here is our research department. And I think this is an important part of the building at this point. Our practice is a UCLA affiliated practice, and so what that means is we've been able to enroll actively patients on trial. We have about 27 patients that are actively involved in a clinical trial right now. So years ago, if they wanted to be involved in a trial, they had to go down to UCLA, and that might mean 2 or 3 trips a week on that 405, and that's not very pleasant
fun.
at all. There are certain people that get to a point in their treatment where we don't have the next thing to offer, but we know that there's a good drug out there, or socially we just have a question that we want to answer. Is treatment A better than treatment B? And we happen to have a trial open for that. So we currently have the ability to put people on the exact same trial that they would be on at UCLA, but do it all here, never have to travel to UCLA, get the exact same treatment that they would, but we've also got the cooperation of UCLA. We can pick up the phone anytime, talk to the main investigator involved in that trial, and the patients can get it all done right here. So there's UCLA is a large group. They've got about 40 or 50 practices in their network. For the last 3-4 years, we've been the top recruiters in that network just because our community really wants to take advantage of that research opportunity. And in some patients, it's made a huge difference. They are now being able to say years later that they were part of a study that is now considered standard, but they got to get that drug before anybody else could.
Well, this is a quantum leap forward for our area.
It's a very big part of what we do, because the field is changing so quickly that we want to be able to offer new drugs all the time for the patients. So we were cramped into a very small space. Some of the files that are kept on each patient that's on a trial ends up getting a binder about this big, and there's usually 2 or 3 other binders that go along with this, and they are kept on site for anywhere from 5 to 15 years. So you need a space that you can accommodate this.
That's for sure.
And the hospital's been very helpful in terms of helping us set up this area for our research team to work through.
Amazing.
So we'll leave this area and go back to a patient area.
Okay.
So generally speaking, this will not be a lot of travel of patients coming back and forth through this. This is about our only long hallway in the whole building, but fortunately it's not an area that the patients will be traveling much. We've kept all of the patient area very much closer to their access, right? But things like the research department require room. and you have to have it. So we've gone through the breast imaging, which is just on our right that we just went through. So this area here is now the physician surgeon suite. So we will have some of our physicians and that are dealing with other aspects of cancer care involved in this area. So through that door there, Dr. Rocco, who is our breast cancer specialist, surgical specialist, will have her office. And again, that's perfectly located for her patients. First of all, almost all breast cancer patients end up having some form of surgery, radiation therapy, chemotherapy, hormonal therapy. So again, you can see how that fits in. They can have their mammogram done right here next door. They can see Dr. Rocco, one step away, and their chemotherapy would be upstairs. Their radiation therapy would be downstairs. So essentially, all of their treatment would be all in a very close proximity.
Now, how long ago, doctor, was the seed for this conceived in your head that I want to do something here in Santa Maria? I want it where a patient does not have to leave our area for the best possible care you can get. How long has this taken you to
Well, I think
get here?
Fundamentally it goes back to how we all trained. We all trained in teaching hospitals where this is the scenario. In a teaching hospital, you run from one department to another, but everything's in that teaching hospital. And then when you move into the community, that usually disappears. But as far back as 7, 8 years ago, you start developing a lot of relationships with our patients. And one of my patients who's become a close friend, Atul Patel, is someone that I gained a strong relationship with. And I took care of his father, and I've taken care of Atul himself. They both had different kinds of cancer, but we would discuss at our meetings, our patient encounters, basically, how difficult that whole process was. Both he and his dad ended up going to UCLA for various types of surgery. We would do scans on them on a regular basis. They'd get blood work on a regular basis. They'd come in to see me. They had to have radiation therapy. So they were really, going to many different locations. And one thing about my friend Atul, who's younger than I am, he's just in his early 40s. At the time he was getting treatment was in his late 30s. He felt like an 80-year-old man getting the treatment. He said, this is very tough, coming back and forth to all these places. And that's sort of where we started pushing the idea of saying, is this something we can do in this community? And I think Santa Maria is unique. We have incredible support of the community. We have incredible support of the doctors as well. And that's what I think what makes this all possible. We were talking about our tumor board earlier. Well, you don't see a tumor board like that in many other places because you can't get the doctors to commit to saying, I'm going to give an hour and a half up every Tuesday of my lunch, or seeing patients or getting a procedure done to come in and discuss all these cases. We've been able to do that for 10 plus years now, and every time we get evaluated by a national agency, they always come back to us and say, wow, we haven't seen a tumor board like this outside of academic centers. So I think the seed for it goes back many years, and it's always been something that we've been thinking about, but generally doesn't happen in a smaller community. But I think in this community, we're poised to do this. And I think just times have changed. And the trip to Los Angeles, when I first came here 16 years ago, was never a fun trip, but it's not pleasant at all now. When you get on the 101 and the 405.
Oh, you try to go, 405's a killer.
Our patients that still have to do it periodically basically tell us that can be a 12-hour day for them. And they'll sometimes have an appointment at UCLA at 8 o'clock in the morning. Well, 8 o'clock in the morning means they've got to leave here at 3:30, 4 o'clock in the morning to get to that appointment, and then they're always 2-3 hours late.
And then they're tired.
Exactly, and then they've got to somehow work their way back. So part of it also has become the fact that it's not as easy to travel now, and it's certainly not easy when you're getting chemotherapy and radiation therapy. So it's been a process that's involved many doctors, the administration of the hospital, and importantly, patients telling us that they need this done. And the reality is, unfortunately, that all of us at some point are likely going to be touched by this building. Whether we like it or not, we're going to have a good friend, we're going to have a family member, we're going to have somebody that's very close to us get cancer. And we just met with Dr. Solomon, whose wife has undergone treatment here. And a few years ago, you would never have thought that was a possibility for him. So we realize that we need this kind of care in our community, and we hope that this is something that other communities will look at and say, boy, if it's possible there, maybe it's possible elsewhere. It's obviously the economic times are a little bit different in terms of climate, but we've been able to make things happen here.
Truly amazing.
So we won't bother going through the office space here. We can go up to the 3rd floor, where the medical oncology department is housed. So people come here for the chemotherapy part and follow up, and so we'll go through this door. This is our check-in area. And again, what we've tried to do is make it as convenient as possible for our patients in terms of getting some of their care done that doesn't necessarily involve the more aggressive part of their treatment. So for patients that come in to get laboratory work done, which is a part of our job every day, basically, all of our patients that are getting chemotherapy need some blood work done first. So they will actually be able to come right off the elevator, sit in this little sub-waiting room and have their blood work drawn here. So this is our Marion lab, now runs this
And your
lab
views
right
are
behind us.
gorgeous out the windows.
Yeah, the
People
third floor
can-
is especially nice, and we'll see that in our chemotherapy suite. But again, we've tried to bring the outdoor lights so that it doesn't feel like you're in a hospital
Right.
or a clinic setting as much. Now, part of our treatment for patients is they often require multiple shots. Just a little shot they get underneath the skin. So we probably give anywhere from 25 to 30 shots a day. This is where Chris in our office gives the shots here.
Little needles.
Little needles,
Not
just
big
underneath
needles.
the skin, and it's
Okay.
basically, it's a 2-3 minute event, obviously, which doesn't take a lot of time. But what we've tried to do is create an area where they can come in off the elevators, come straight to that waiting area, have Chris give the shot, and go right out again without going
they're
through
done.
the fuss of going through the entire office and things like that. So it makes the process as simple as we can without having long delays.
Well, there's the enemy of myself, is the scale.
Right. Well, in our population, we're worried about keeping weight on,
that
sometimes
right?
more than off. But, so these are our typical exam rooms here. Nothing fancy about them, but again, trying to create some light. We need to go in here to turn the light on, actually, but trying to create a little light and have a feeling where it's not again so clinically cold.
Yeah.
and
Because
just a
most
warmer
places you
environment.
go, there's no pictures on the wall, it's just
Right.
paint.
But
and-
unfortunately, our patients, if they're getting treatment, they can be here every 2 weeks or every 3 weeks for months at a time. And so we want to try to make that process, first of all, spend as little time here as possible getting in and out quickly, but at the same time, give them an environment that's not as stressful or they're thinking about treatment the minute they come in. So we can go down this way here to our other treatment area. So the way our field works is that patients that are coming in for chemotherapy will initially come in, see the doctors there to make sure that they're all set to start their chemotherapy that day, and then we will walk them through to the treatment area, which is our infusion suite. And we've, again, tried to make that as pleasant as possible, even though
It's
not
no
a
fun.
pleasant, it's no fun.
It's no fun.
And some of our patients will have a fairly easy treatment in the sense that they're here for 15, 20 minutes.
Is that right?
But others can be sitting here for 8 hours
Oh my
at a
gosh.
time. So we try to make isolated areas here where if people don't want to be in a bigger room, they can have more or less of a private area. We've actually even got a little veranda area where their family members can sit outside and just get some fresh air. We have created a little nutrition area here where the patients can get a little something to eat, or their family members can get a little something to eat because they're here for such a long period of time. And then we've created an area that's nice and wide open. We've done some extra
Beautiful
things.
views.
Beautiful views. And again, if we look out here, we'll see the hills. And depending on what time of the year that is, they could be red, they could be green, they could be brown. And again, just try to create not a clinical experience, not feeling like they're shoved in a closet getting chemotherapy for 8 hours, but rather in a warmer environment, in a non-hospital type of environment, and just try to make the experience a little bit more pleasant for them. They actually, believe it or not, if you're on a cycle where you're coming in every Tuesday, let's say, you end up meeting the people that are coming in
You
every
know the
Tuesday.
guys, yeah.
And they start requesting who they want to sit by.
Is that right?
And they request their
Oh my-
nurses.
It's kind of
certainly.
like a club.
It can be like a club. You know, I once had a group of 4 engineers that were all getting treatment for colon cancer, and they would compare their side effects and how they were
And who's
handling
doing
things.
better, huh?
They actually looked forward to the social experience
I'll be darned.
of meeting it. Now, obviously, they'd rather not be getting chemotherapy,
No,
but
but-
they try to make the best of it. And this is an area where the nurses have to be watching the patients closely because they're getting drugs that can have side effects. And so we've created an area where they can be looking at their computer monitors but watching the patients at the same time. And that's why we don't have individual treatment rooms, because the nurses have to keep a
They have
close
to be
eye
right
on
on
the
the
patients.
ball.
Right.
Sure.
So we've done a little extra things that at the time of construction, you don't know whether they're going to work or not, but the tiles are a little more soundproof tiles, and the flooring is a little spongier for the nurses, and also sound absorbent. And it turns out that it actually works pretty well, despite the fact that the room's large and we can have 15, 16 people getting treatment here at the same time. It's actually turned out to be pretty quiet and comfortable for the staff to work in and the patients to work in.
And the guy can be sitting here and say, hey, when I'm done with this chemotherapy, I'm going and buying that Corvette. That's what I'm going to go do.
Right, they can then shop at Home Motors in the meantime.
And get the Corvette out.
We're going to take advantage of a little bit more technology, which we should start up in the next week or so here, where, as you notice, there's no TVs or anything in here, but what we've created in our infrastructure is everybody's going to get an iPad. And through that iPad, we're going to have the patients being able to go on the internet or read a book through Amazon,
Right.
or watch TV or watch videos through Netflix. We'll provide them with the codes, and they can watch that. So they can have their own little personal entertainment area rather than having one TV hanging from the ceiling that everybody either watches or doesn't watch. Occasionally we do get some sicker patients that require more than just a chair, but rather a bed. So we've got a couple of rooms here where the patients can actually have a bed and they can be here for 6 or 8 hours or whatnot. Not intended to have anybody stay overnight, but certainly some of our patients don't feel that well during the treatment, so it allows us to still be able to keep our eye on them, but have another opportunity for them to be somewhere other than a chair. So this, unfortunately, is where a lot of patients spend their time. So we've spent a fair amount of our time trying to make this look as good as it can and be as functional as it can to get the patients in and out, but give them an environment that's a little bit more pleasant and a little less clinical than it's been in the past.
It's truly, truly something.
And we really wanted to take advantage of the views.
You have to be very, very proud of this document.
Yeah, I'm happy the way it's turned out. Obviously, we've got a long way to go in terms of getting everything set up exactly the way we want to and having all the departments set up. But I think we're moving in the right direction. And what it allows us to do, I think, for the future is to keep pushing the bar, keep pushing the envelope, bring better people, better trained physicians, and just continue to expand our services so that we're constantly on the cutting edge. And I think that's all we're all looking for, whether it's a patient or the physician, is to be able to do the best we can. It's not an easy business because some of our patients don't do as well as we'd like them to do, obviously, but I think keeping them here and treating them as humans and patients that have families and don't want to be spending all their time on the road, especially in those circumstances where their time has become now extremely valuable. If there's a limited amount of it left, then we want to focus on that. And I think this is allowing us to do that. It's something to build towards for the future, and hopefully as the field changes, which it does, we're prepared to handle some of those changes.
That's so good. I'm so proud that I'm the mayor of the city of Santa Maria at a time when we've literally made a quantum leap in healthcare here, not only from your particular Mission Hope, but Marion Hospital as well. It's amazing what you have accomplished.
Well, and I think the community's been a big part of it, from the community of our patients telling us what they want, but also from the community of people that have helped us put this project together. As you know, it's all community owned, basically. Right. I'm the only physician that currently is an owner of the facility. Most of the other owners, or all of the other owners, are actually strong community members.
Yeah, people I went to school with.
People you went to school with, people that we see playing baseball on TV
all the time.
And whatnot. Right.
That's
so
right.
They felt very strongly that this is something we needed here, and at a time where nobody else was willing to take a risk from a business point of view to create a structure like this, they were willing to do that, and I think that's what's made it possible.
Well, Santa Maria is a very, very generous community. A very compassionate community, always has been, and so I can see why it's here.
Yeah, it's going to be.
And I want to thank you for taking me around and showing
my pleasure.
me.
My pleasure.
Thank you. Thank you, Doctor.
Thanks for coming.
Please join us for our grand opening April 25th at 3 p.m.